All right, so good morning. Again, we're in the interest of time, we're gonna go ahead and get started. My name is Jeanette Haregi, and I'm the Public Information Officer with the Ventura County Area Agency on Aging. Welcome to the VCAAA's Aging and Disability Resource Network meeting. These meetings are designed to bring us all together as community partners so that we can stay better connected and informed of what each of our agencies and organizations are working toward. We're going to start the meeting today with introductions and any brief announcements you'd like to make. And then we'll hear a presentation from Jaden Gaines with the Independent Living Resource Center. So we will start with introductions, and I'll go ahead and go down the list of folks that I see and ask you to give a quick introduction. And again, cameras are optional. You can just use your voice if you're more comfortable with that. All right. Denise Noguera. Would you like to give a quick introduction, Denise? I think she put herself on mute. Okay, Kevin.
Hold on.
Good morning, Kevin. Would you like to give a quick introduction?
Just a minute.
Okay.
I can't find the Zoom.
Okay, Kevin, I can come back to you, Kevin. Alan Zadkin, would you like to give a quick introduction?
No, not at this point, thanks.
Okay. I have, how about Ben? Ben Rhodes.
Hi everyone, my name is Ben Rhodes. I'm the Direct Programs Operation Manager here at Ventura County Area Agency on Aging. Happy to see y'all, or hear y'all, as the case may be.
All right, Kevin, are you ready?
Yes, I am. I'm a volunteer HICAP counselor, and I've been with the organization for a little more than a year now.
Awesome, Kevin, thank you. And HICAP, for those of you who are not familiar, is under the umbrella of the VCAAA. It's a health insurance counseling and advocacy program. All right, it says B. Parker, I think that's Beth.
Yes, hi. My name is Beth Parker. I'm with Housing Authority of Ventura.
Awesome, thank you, Beth, for joining us. Margaret, would you like to give a quick introduction?
I'm Margaret Sheep, Gold Coast Transit District.
Welcome, Margaret. Sonia Vaughn.
Hi, good morning, everyone. Sonia Vaughn. I'm sorry, I missed the introduction. Is this the introduction part?
Yes, introductions.
Okay, hello, everyone. I'm Sonia Vaughn. I'm now the HICAP Program Manager at VCAAA.
Hi, Sonia. Dina.
Hi, good morning, everybody. I'm Dina Antiveras, and I work for Cottage Hospital's Coast Caregiver Resource Center. I'm a family consultant, and we provide supportive services to caregivers of those with neurological impairments.
Welcome, Dina. Denise, would you like to go?
Hi, everyone. Can you hear me okay?
Yes.
Okay, good morning. My name is Denise Noguera. I work for the Ventura County Area Agency on Aging, and I'm currently the call center manager. It's great to be here. Thank you.
Hi, Denise. All right. Ellie.
Hi, my name's actually Kira. I'm sorry, I must be signed in under one of my children or my daughter. So,
okay.
I'm just a parent actually. I just got your link from Rainbow Connection in Simi Valley at Tri-Counties, and I was asking about resources for my son who is actually, he's 16, he's on the autism spectrum. And so I was just here to learn about what services are available to him through Independent Living Resource Center as he, gets older and is 18 and that kind of thing.
Awesome. Well, welcome. Glad to have you here.
Thank you.
Jacqueline Valles, we're giving out introductions. Would you like to introduce yourself? And again, for those that have just joined, cameras are optional. It's totally up to you.
Can you hear me?
Yes, I can hear you, Jacqueline.
Oh, hi.
Hi.
I miss all of you at AAA.
We miss you too.
So I am the Behavioral Health Integration LCSW here at CMH. working with patients with their mental health needs and providing resources, community resources. So thank you for presenting today.
Awesome. Glad to have you. Berta, would you like to give a quick introduction?
I don't know if you can hear me, but I'm using my headset. My name is Berta Medina Carranza. I'm a HICAP counselor and also the HICAP outreach and volunteer coordinator. So here at the Ventura County Area Agency on Aging.
Thank you, Berta. So Berta, I think her microphone is it's hard to hear, but Berta is with the VCAAA. She's with our HICAP, our Health Insurance Counseling and Advocacy Program, and she's a HICAP counselor, another fantastic HICAP counselor that we have, and she also works with the HICAP outreach team. So Berta is a fantastic resource with our HICAP department. Thank you, Berta. Jaime?
It's actually Jamie, but that's
Sorry,
okay.
Jamie.
It's okay. It's a common thing that happens. I'm a diabetes educator and care coordinator with Centers for Family Health.
Sorry about that, Jamie.
No worries.
I was looking at it thinking, okay, based on the spelling, it's either Jaime or Jamie. I'm not really sure, but I apologize for that.
My husband calls me Jaime. It's okay.
Okay.
Thanks.
Well, welcome, Kate.
Hi, my name is Kate Mills. I'm the ministry coordinator for the wellness community at Our Lady of Assumption in Ventura.
Welcome, Kate. Thank you. Joanna?
Hi, I'm an LVN at CMH and I help patients with chronic care management. So just looking for resources.
Fantastic. Thanks for joining us. Jerica?
Good morning. My name is Jerica and I work in the Information and Assistance Department. I answer incoming calls with the Area Agency on Aging and work hand in hand with Kelly at the Independent Living Resource Center to provide community transition support.
Thank you for joining us, Jerica. Layla?
Hey, I was so ready the entire time and then you caught me off guard. I'm Layla Thayer Malone. I'm from the Alzheimer's Association. I'm the program and education manager here.
Welcome, Layla. Thank you. Leslie?
Hi, everyone. I'm Leslie. I am the volunteer coordinator for the whole Ventura County Area Agency on Aging. Thank you.
Thank you for joining us. Loretta?
Hi, I'm Loretta Allen, and I am the public member from the Council on Aging for Thousand Oaks, and I'm also working with Canal Valley Village, and we're here in Thousand Oaks, and we're always looking for resources for our members.
Welcome, Loretta. Loretta is also a member of our VCAAA Advisory Council. Mei Lee? I don't know if Mei Lee is unmuting. Mei Lee is part of our HICAP team as well, and she's another fantastic resource for our health insurance counseling and advocacy program. Myra?
Hi, I'm Myra. I'm the coordinator for the Behavioral Health Integration Program here at CMH. I work with Jackie Baez.
Awesome. Welcome. Paula?
Hello, everyone. I don't know if you guys can see me. Can you? Okay.
Yes, I can see
so I'm a Care Connections coordinator here at CMH, and I mainly work with the Medicare population, making sure they're getting their wellness visits and then transitional care management, which helps them transition from the hospital back home.
Awesome. Welcome. It's under the name under here is R. Valenzuela.
Hi, I'm Rita. I'm one of the LVNs with Centers for Family Health, a care coordinator, assisting patients, and we're in to get all the resources we can get. Thank you.
Awesome. And Vanessa?
Hi, my name is Vanessa Kane. I am the community living advocate here at the Independent Living Resource Center.
Welcome. All right, and then Jaden will be introducing herself shortly. So I will hold off. Did I get everyone else, or have I missed anybody? The list is kind of added or changed as I've added folks, so I don't want to miss anybody. Please go ahead and introduce yourself if you haven't already. All right. Well, thank you again for joining us. It's fantastic to see the comments in the chat, just, people reconnecting. That's the whole purpose of, part of the whole purpose of these meetings is to get, keep us all connected. And really, as a community, we're here to serve, older adults, people with disabilities, and caregivers. And it's just really fantastic to see these connections continue. So without further ado, we will get to our featured speaker. If everyone can mute themselves at this time to minimize any interference with the presentation, that would be super helpful. Our speaker today is Jaden Gaines. She is the Program Services Manager with the Independent Living Resource Center, which is a critical partner for the VCAAA. Jaden, if you're ready, do you need to share your screen, Jaden?
Hi, yes, if I can, that would be great.
Yes, I will. You should be able to share it now if you like to try.
It says it's still disabled.
Okay, let's see. All right, how does that work?
Okay, got it. Thank you.
All right. Thank you and welcome, Jaden. Thank you for joining us today.
Not working.
Perfect. Hi, everyone. As Jeanette said, my name is Jaden Gaines. I'm the Program Services Manager at the Independent Living Resource Center. I'm coming back from a long vacation, so I'm going to have a lot of brain farts. So please forgive me for those, but I will definitely be sure to clarify anything or answer any questions you may have at the end. Let's see if I can figure out how to move it along here. Okay, the mission of the Independent Living Resource Center is to promote independent living and full access for people with disabilities. And we do that through advocacy, education, and action in our communities. We serve Ventura County, Santa Barbara County, and San Luis Obispo counties as well. So we cover a good amount of the Central Coast. A little bit of history of the IL movement. IL stands for Independent Living. So the desire for empowerment and self-determination for people with disabilities gave rise to the IL movement. And it began in the 1960s in Berkeley, California, and in other places in the United States. Groups of individuals who had disabilities began working together to eliminate barriers in their communities and to receive equal access to programs and services. On the top right corner, you'll see Ed Roberts, who's often named the father of the independent living movement. And then down below, you'll see Judy Human, who is one of my favorite disability advocates, advocating back in 1977. A little bit of history of the IL movement. In 1964, the Civil Rights Act was passed, and that prohibited discrimination on the basis of race, color, religion, sex, or national origin. And then in 1973, Section 504 of the Rehabilitation Act was passed, and that prohibited discrimination on the basis of disability in federal programs. And then in 1990, the Americans with Disabilities Act was signed into law, and that prohibits discrimination against people with disabilities in areas including, but not limited to, transportation, employment, and public accommodations. And the anniversary for the signing of the ADA is actually coming up later this month. And July is actually Disability Pride Month. Also, just a fun fact. So what is independent living? I've talked a little bit about it, but what does it actually mean for you, for your loved ones, for the population that you serve? Independent living looks like allowing and empowering people with disabilities to make their own choices and to take responsibility for those choices. It also includes knowing, or in our case, informing the person with disability of their options in the community. And it includes allowing that person to pursue a chosen direction. So essentially, it kind of boils down to self-determination being key. That's the real essence of independent living. So now I'm going to go through the services available at ILRC. I always start this off by saying we have a lot of services at ILRC. So please bear with me. And again, I'll answer any questions you have at the end, or if you want to throw them in the chat too. I know Vanessa's on and she can kind of keep an eye if she's available. So starting off, I like to start off with the Aging and Disability Resource Center, or ADRC, because we don't necessarily consider it a service, but more of who we are. And that is a partnership between us and the Ventura County Area Agency on Aging. And together we provide long-term supports and services to people with disabilities, older adults, caregivers, and family members. And essentially we provide information and referral, we provide options counseling, short-term service coordination, and we help with folks who want to transition out of institutions as well. And we actually have been labeled as an emerging ADRC in Santa Barbara and San Luis Obispo counties as well. So in Ventura County, we've been established as designated for a couple of years now. We're actually emerging now in our other counties of Santa Barbara and San Luis Obispo. So we're excited to expand on the great work that the ADRC does. And so I mentioned information and referral on the last slide. What does that mean? Essentially, it just means that we have, this is the person, our INR specialist is the initial point of contact with consumers, families, you as a service provider or a community partner. Anytime you call ILRC, you'll talk to our information and referral specialist first. And her name is Jennifer in the Ventura office, and she's also bilingual as well. And essentially, she connects anyone who calls with the appropriate staff member or provides community options via a warm handoff. And a warm handoff just means that we will ensure that the consumer gets to where they need to be and not just give them a number and hang up on them kind of thing. We pride ourselves on having great partnerships with community partners throughout the county. And so most of the time we're able to call up that agency and say, hey, I want to make a referral, or hey, I just talked to this consumer and they're going to be coming your way. Or hey, can you reach out to this person? They seem a little shy or hesitant to partake in services, but I know it would be really great to connect you with them. So essentially, that's what our information referral specialist does. And again, they're that first person that will answer the phone when you call us. You'll talk to them. Peer support. This is one of my favorite parts of ILRC. We are a peer-run organization, and that means that 51% of our staff and 51% of our board have to identify as having a significant disability. And that goes for every independent living center across the nation. There is an independent living center that covers every single county in the United States. Here at ILRC, our number is actually, I believe it's about 80% of our staff identify as having a significant disability. I'm not quite sure about our board, but it's definitely above 51%. And the benefit of this is that consumers get to meet with staff that have personal experience with disability. And people with disabilities get to educate, guide, and guide each other and draw on that shared lived experience. So they get to talk with someone who more than likely knows what they're going through, or to some extent has experienced something similar. And again, that's with every independent living center across the nation. We also are currently holding a virtual peer support group, which runs every Friday. And essentially consumers and staff, anyone, community partners can come and join our Zoom meeting. And there's oftentimes themes for each meeting. Sometimes we'll talk about, sports. Sometimes we'll do a trivia day. I know this week they're doing something on TED Talks. So it's always a really fun topic and a good time for everyone to kind of come together and decompress a little bit on Friday afternoons. Advocacy, this is probably our largest service. And I say that because it's ingrained pretty much into every other service that we offer. And what it kind of boils down to is that we help advocate for equal access for people with disabilities and older adults in areas such as housing, in-home support services, employment, and public benefits like SSI, SSDI, etc. We also have a systems change coordinator who works with policymaking and legislators to further equal rights and access for people with disabilities through systems change advocacy. We offer some vocational services. We can help with locating and applying for jobs. We do other soft skills training like interview prep, creating a resume, creating a cover letter, etc. We also work closely with the Department of Rehabilitation. So if someone needs a little bit of extra support or maybe needs a case manager, we will refer them over to DOR, or some of our other partners are Goodwill and PathPoint. We also maintain a personal assistant registry, and the platform we use is called Quick Match. Essentially, we refer and screen caregivers, and then we screen caregivers and then we refer them out to consumers as needed. We are not the employer of the caregivers that we refer out. We're kind of just the connecting piece. We're just the connecting piece, and this is a private pay service, so the consumer would have to pay out of pocket directly to the caregiver for the service. Our caregivers on our registry tend to charge anywhere, it's going up actually, as I'm sure you all know. There is a huge caregiver shortage within the state and the nation. I believe it's about $18 to $25 per hour now that our caregivers are requesting. So it's definitely increasing, but it's still a good alternative for folks who can't afford a higher rate of services. And we also provide advocacy and help in navigating IHSS or in-home support services. We can help folks locate a provider for IHSS as well. Housing navigation, so we can help leverage the internet and provide support in the housing search. We also provide information on housing services, homeless shelters, transitional centers, etc. And we can help with application assistance. So if someone wants to apply for, I'm forgetting the name. If someone wants to apply for public housing or Section 8, we can help them with that. If someone needs to recertify their Section 8, we can help with that. We also, this is a little bit of an older PowerPoint, but we were recently added into the Coordinated Entry System, or CES, which is also called Pathways to Home in Ventura County. So we are part of HMIS, or Homeless Management Information System, as well within the county, which has been a great resource for our consumers. Here we go. We also offer assistive technology services, and essentially we provide information on AT devices like mobility devices, text-to-speech programs, and digital recorders. You'll see on the left-hand side some examples of what AT looks like. And we also assist in locating funding for needed equipment. So we don't, unfortunately, we're not able to purchase AT items for folks, but we will help them explore funding resources in our community. Transportation, we don't provide transportation, but we can provide transportation resources. And we can also help, and I know that this was pretty much paused during COVID, but now that folks are starting to travel and vacation again, we can help plan for those things and ensure that planes, trains, any transportation modes are ADA accessible for folks that need it. And we can also provide some resources for vehicle modifications as well. Food access, we can provide resources to consumers who don't have access to healthy foods, and we refer to various food programs throughout the county. Independent living skills training, this is another one of our bigger services. We provide skills training to consumers who are learning how to live independently in their community. And this looks like setting tangible goals and working to achieve them alongside us, ILRC staff, and we also refer to other agencies as needed. So independent living skills training, it's such a broad term to use, but I'll give you some examples of what ILS training looks like: creating, opening a bank account, creating a Facebook page, obtaining bus passes, applying for school, applying for financial aid. All of those things can fall into ILS training. For folks who need something a little bit more intensive, or something that may require a specialist, we do refer out for things like that. Another one of our bigger services is benefits counseling. So we have two benefits advocates actually, who assist with public benefits, and they can provide information about those benefits like SSI, SSDI, unemployment, SNAP. And they also help with health insurance coverage, or they can help provide information about that stuff too. Medicare, Medi-Cal, all other types of health coverage as well. And a big piece of, again, another big piece of what they do is help apply for those public benefits, and then also help advocate in disputes with public benefits providers. Transition and diversion. Jerica touched on this a little bit earlier when she introduced herself, but this is one of the services that we provide in conjunction with the Area Agency on Aging. And we provide assistance to consumers who are transitioning out of institutional settings like nursing homes, skilled nursing facilities, hospitals, boarding cares. We help them transition back into the community of their choice. So if they want to transition back into their home, or if they want to transition into, maybe they need to downsize, maybe they want to transition into the home of a family member, we'll help them transition back into their community of choice. And so some of the services that Kelly offers as a transition coordinator are locating housing, obtaining durable medical equipment, or AT, assistive technology, locating personal assistants, and making the home accessible with home modifications. And those are just some examples. We also offer some youth services. And I apologize, this position as of last Friday has officially been kind of dissolved and absorbed by Vanessa, our community living advocate, but we definitely still provide these services. Prior to last week, we had someone dedicated to youth services. However, now Vanessa is doing youth, and she's absorbed these roles too. So essentially, our youth advocate, or now Vanessa, our community living advocate, provides services in Ventura County for consumers aged 14 to 30. And we were in the process of developing some age-based support groups. Those have not gone up, and they have not been live yet, but that was our plan too. And then group trainings and workshops for youth. Though we had one workshop a couple of months ago where Vanessa shared about all of the services that she offered. But again, these services are definitely still available. We just don't have a dedicated staff person for youth services. And I'm happy to clarify that at the end. I know that's a little bit confusing. Next, we have our OIB program, which stands for our Older Individuals Who Are Blind. And this is essentially case management for folks who are 55 or older and are blind or severely visually impaired. And these consumers can receive O&M training, orientation and mobility training. They also can receive independent living skills training. We have blind and low vision technology, assistive technology for those folks, and peer mentoring as well. We also currently have our Alzheimer's disease and related dementia program, or ADRD. And this is essentially case management for people with intellectual disabilities, or if they have Alzheimer's or dementia, or at risk of developing either of those diseases. And essentially, we provide respite support, fall prevention assistance, caregiver support groups, case management benefits, etc. Getting to the end here, so bear with me. We also have emergency preparedness and disaster response planning. So we have a emergency preparedness services manager, and he can help folks create an emergency evacuation plan, obtain backup power devices where appropriate and eligible. So essentially this position really came out of a couple of years ago. Ventura County had a number of public safety power shutoffs, or PSPSs, and folks who rely on medical equipment that requires power were kind of left to their own devices, essentially. And so we worked with SCE and the California Foundation for Independent Living Centers. And we have this program now where we can provide those backup power devices, essentially they're big batteries, for folks who are going to experience a public safety power shutoff, or PSPS. And we can also help folks apply for the medical baseline program with SCE. And that essentially just gives advance notice of those public safety power shutoffs. And it gives a small discount on their electricity bill as well. Interpreting, so anyone can contact us to request an American Sign Language interpreter to ensure that folks who are deaf can have full access to communication. We maintain a registry of ASL interpreters that receives a lot of, we get a lot of requests for this service, which is great that it's being that is being utilized in our catchment area. We also have a COVID-19 outreach coordinator, and he provides services related to testing, vaccination, PPE within Ventura County. And of course, examples include obtaining in-home vaccines, registering for booster vaccines, PPE drop-offs, and general COVID information. Our coordinator can provide those services. So those are all of our services. And again, I just went through our services. We have a number of other programs that we provide as well, that fall into like AT or other, mostly AT. So any questions that you may have about really anything related to disability or older adults, please contact us. Just because it's not on our website or not in this presentation doesn't mean that we don't offer it. So I highly encourage you to reach out to us. Even if it's not something we offer, again, we do the warm handoff, so you'll get to where you need to be in a kind, respectful way. As far as accessing services, all of our services are provided at no cost, with, of course, the exception of our personal assistant registry, which is private pay. And having a disability, or being an older adult, or being a caregiver, or being a family member of a person with a disability or older adult is our only eligibility criteria. So I need to update this a little bit, but we don't require any documentation of disability or anything like that to receive services. The only thing we do require is active participation from the consumer that we are providing services to. And that's because we don't give ourselves the label of case managers. We call ourselves advocates, and advocates usually work alongside the people that they're serving. So that's why we require active participation from the consumer. And then again, the no wrong door policy falls right in line with the Aging and Disability Resource Center, where you can contact either the AAA or us and get to where you need to be in a timely manner. And then here I just have all of our locations. Again, our headquarters is in Santa Barbara. We're located in Ventura, in the city of Ventura, right next door to the AAA. We also have an office in San Luis Obispo, and we have another office in Santa Maria. So that concludes my presentation. I'm happy to answer any questions or provide any clarification for anything I went over. Whatever anyone wants to chat about, I'm happy to do so.
Awesome. And in just a second, Dina, if after Dina goes, if everyone can, who has a question, could just raise their hand so that way I can go through and we can make sure we get to everyone. Dina, go ahead.
I have a question, and I can't remember the slide, but it was one of the first ones. I have a lot of caregivers that have no clue on how to get Medi-Cal, IHSS for the person they care for, their care receiver. It's been, and I know that they would benefit. Can they access ILRC for this service, the navigator for that?
Please, yes, totally, please do. Yes, we help with the entire process with IHSS, with applying, advocating for more hours, you know, disputing. If someone is denied hours, we'll help advocate for that too. But yes, as simple as applying, yes, we help with that too.
But making sure that the caregiver does it, because the care receiver oftentimes cannot do that for themselves. Right? Yeah, just making sure it's the caregiver can do that.
Yeah.
Okay, thank you.
Yeah, totally.
Thank you, Dina. Paula?
Yes, I wanted to know regarding the transitional care services that you noted that you guys help with. I know that when I'm working on that with our patients, there's some that are being discharged out of the hospital but don't have, they're homeless. So in this case, when I have those patients, is this something that I can transfer over to you, or maybe work with you guys to help that patient? I don't know, work on housing or something like that?
Most definitely, yeah. And I'm sure, Paula, you know, the housing crisis within the state and our county is alive and well. So we definitely work alongside them. But we don't have any housing ourselves, or we don't have any special connections with housing providers, but we can totally work alongside you and the consumer to help locate housing for sure.
So when that happens, I would call, is it that the Ventura office number, or where would I got it?
Yeah.
Okay.
You can connect with the appropriate staff member via that number. Yeah.
Thank you.
Awesome. Thank you, Paula. Does anyone else have any questions? Any other questions? All right.
Oops. Sorry.
Well, that was a great presentation, Jaden. Thank you so much. It's similar to the VCAAA in that, you know, there's a lot of programs and services to cover, and you know, it's just kind of a lot. So again, if you have any specific questions for your particular situation, or a client that you're working with, or a family member that you're seeking services for, please don't hesitate to reach out to Jaden directly, or you can reach out to me and I can connect you to Jaden or our VCAAA team as well. So thank you all again. As I mentioned, the Independent Living Resource Center is a vital partner for the VCAAA, providing critical services for Ventura County residents who are living with a disability. Our ability to provide a streamlined, no wrong door approach as part of the Ventura County Aging and Disability Resource Center is because of community partnerships like the one we have with the ILRC. So thank you again, Jaden, for your time today. In the chat, you'll notice that I've provided my contact information. So if you need to be, and Jaden has just added hers, if you aren't receiving emails from me with VCAAA program and service information, and also the meeting notices for the ADR network meetings, go ahead and email me and I can add you to that list. Our next Aging and Disability Resource meeting is scheduled for October 6th at 10 a.m. and more information on that meeting will be available in the coming weeks. So thank you all again for attending today's meeting. We had 31 participants today, which is a pretty good group. So thank you all, and please feel free to reach out to me with any questions, and stay well and have a great day. Thank you all.